Thanks for staying with us on The Real Story. We are not only experiencing a COVID crisis, but a mental health crisis for both adults and kids in our state. Leaders of the General Assembly saying last week addressing the problem is going to be a priority during the upcoming session, and Republicans too say that they're on board, which is encouraging news for children and family advocates, especially my next guest. Connecticut seeing an increase in domestic violence cases as pressures mount at home, in homes. Now this morning we're going to talk about what's happening and what needs to be done to mobilize resources to help. Joining us this morning, Megan Scanlon. She is the president and CEO of the Connecticut Coalition Against Domestic Violence. And Jane Adamek. She is a child and family advocate with the Umbrella Center for Domestic Violence Services. Good morning to you both. Thanks for being here.
Thanks for having us.
All right, so I'm going to start with you, Megan. Talk about the rise in domestic violence cases that we are seeing. I would assume it's pandemic related, right? Because we're dealing with people having issues with their jobs, having issues with childcare. I mean, all of these pressures at home can lead to an increase, unfortunately.
Yeah, so I think we've obviously seen, the pandemic as one public health crisis, but domestic violence is certainly the other sort of hidden public health crisis that we're dealing with day to day. We're seeing an increase in the need for services, but also an increase in the complexity of the situations that are coming to us. So we are seeking funding from the state in terms of investment in our family and child advocate in order to invest in our future generational change. If we're going to address this issue, we need to sort of get to the root of it, and it's giving families the skills and children the skills to cope after or during a domestic violence situation.
Jane, you work directly with these families. You're on the front lines of this. How bad is it out there right now?
Well, it's pretty busy, I'll tell you that. Our shelters are full, they've been full. And I think that, like Megan said, the complexity of the cases is really what has the child advocates super busy. The needs of the families are really great right now. They've been great, forever, but I think especially with the pandemic, I think it's made getting to the families a little harder, but I think I'm seeing lots of school-related work that's additional work for child advocates. Especially during when everyone was online, remote learning, there was a lot of running around with computers and getting kids, hooked up, teaching families how to get online. But I think, in terms of the complexity of the cases, that's really what is taking up all of our time.
And explain, you both had said the complexity of these cases. So, I mean, obviously it is complex, we know that, but is there something specific that's different from before, aside from, I would assume it's COVID, but what's making them complex?
I think it's complex because, there's the added need for, pandemic-related services. However, families are in this heightened state. They're very nervous. They're very worried about their children. They're very worried about themselves. Making a decision to come to shelter, I think, during this time too, is like a huge decision on their part. So that's that's complex because they're already in a state of feeling not safe, and so when they come to shelter, they're worried: are they going to get COVID?
Yep.
But also the needs of the families. Changing doctors, changing schools, changing. Not seeing family members, not having family and friends that maybe can help them out during this time. So.
Right, that makes things much, much more complicated, I can imagine. All right, so Megan, you have these 18 full-time positions, right? They are child and family advocates, which Jane is what you are. I would assume. And
Yes.
you are looking, I guess the state doesn't contribute really any funding to this, Megan, you were explaining, right? And there's a small amount of federal funding, but you're looking at this and you're saying to the legislature, we need help. We need some support here.
Yeah, I think, given what the legislators said their priorities are upcoming, knowing that child mental health is one of the priorities, we're lucky that Jane is a full-time child advocate, but not every site across the state has an advocate that can dedicate their time full-time to this work. So we are looking for this funding to ensure that all of our 18 sites, so no matter where you live, what your zip code is, that you're able to get access to a child and family advocate for yourself and also your children. And I think it's, we've talked about this, it's one of the most significant things we can do for very little money. It's just under $1.5 million annually in order to create some real generational change and break some of these cycles of behavior that we see in families that have experienced or are experiencing domestic violence and family violence.
Yeah, and just to put that in perspective, because someone might be watching and being like, whoa, 1.5 million is a lot of money. Connecticut's budget biannually is like $40 billion, and you have lawmakers again this year saying that they want to put resources in. This could be a bipartisan effort. It sounds like both sides are looking to infuse some help in our state to address this, and this comes at a time where you all are feeling like we need these positions, we need to fill these. Any feedback, Megan, from lawmakers at this point?
Yeah, we've had some really good initial meetings with some key lawmakers on this issue. I think everybody understands why there is a need here. I think, living it day to day like Jane is, I think really educates the public in terms of what these families are going through. And this was a problem before the pandemic, right? We were seeing increases before the pandemic. The pandemic has exacerbated a situation that was already there. So I'm optimistic that we can make progress with the legislature this year. I think, everybody understands that investing in our children is a priority. And I think for $1.5 million, it's 0.01 of the entire state budget. So to be able to make this kind of investment and the return that we can have for generations, I think I'm optimistic that we can work with both sides of the aisle to get this done.
Jane, I'm going to give you the last word on this. Tell us why these positions are important from your seat and your vantage point, working directly with families who are in crisis. How would extra positions help in our state?
It will give more time to the children who need the support. And, right now, these kids deserve equal time with a child advocate, and they're not getting that right now. The parents and children who come to the safe houses are met, and they have immediate needs that have to be met. And then, another family comes in, another family. It rotates. There's multiple families coming in at the same time. Families are leaving, families are coming, and the children deserve to get the assistance and the support of a child advocate who can help them understand what is happening in your family, and to help them to feel safer, help the parents to help their children feel safer. And this is the job that needs to be done right now. I am full-time, but I have 2 safe houses that I work in, so it's still me splitting my time and doing other things as well. I do I train new staff. I go to trainings. I work out in the community sometimes, and that's not a lot of time to spend with families in shelter. And I think all the child advocates are feeling the same way. Like they can't do enough. They can't be there enough.
Right. You got a lot of workload, and if you had more of you're sharing that workload. So that does make sense. Jane Adamick and Megan Scanlon, thank you both so much for coming on the program. Megan Scanlon with the Connecticut Coalition Against Domestic Violence. We appreciate you bringing this issue to light, and please keep us updated on how efforts go when the session starts in February.
We will. Thank you so much, Jen, for your time.
You got it. All right, that does it for us on The Real Story. If you want to watch these segments again, head to fox61.com or download the Fox 61 app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61. Have a great morning.